just now what we have seen is a glimpse of the Andy's face transplant case, and in the upcoming part of the video we will see more details about his case and two more new cases. But before going to the next part of the video, I would like to emphasize on a very special point that as NEET PG 2024 is coming just in a month, and I think it's less than a month time. So the most important part of clearing any exam is giving a good attempt of the previous year questions and previous year topics, and to focus on that and to give your best hit on that, I have a special gift for you all. It is Reflex app. I know most of you have already heard and know about the Reflex app, but I will like to give you more information about it. Reflex app is the only app which is PYQ based and give all the PYQ to you of NEET PG and the AIMS. Actually, the most important part and most important thing to clear in exam is to like make your previous year questions and previous year topics as strong as you can. So in the app you can see all the PYQ. For example, anatomy, physiology, biochem, you can see all the previous year questions of the AIMS and the NEET PG. And the special point and good thing is there is highlighted that this question is from NEET or the AIMS PYQ. So if you want to give only INSET exam for the AIMS or the NEET PG, you can attempt questions specifically. There are questions for all the 19 subjects in it. The next thing is you can find the papers directly, like AIMS November 2011 paper. You can see all the questions for 2020 and you can find from all the recent papers. The next thing is you can see there is an option to create your own test for, like a custom module. So you can give a mini test or a grand test, or you can create your own custom module for 10 questions, 20 questions, or any n number of the questions you want. You can choose specifically NEET MCQs or AIMS MCQs or both, and there is option of including bookmark questions also, which you want to include or exclude. It depends on you. And the notes part is really an awesome thing. I myself use it while I'm traveling in buses or metro, so the all concepts can brushen up. And all of this you are getting in just a very discounted price, and 6 months subscription cost 599 rupees and 1 year of subscription cost only 948 rupees. So let's get back to the video. Thank you.
Killing my friend!
Who's killing your friend?
Tim, my chimpanzee!
Her nose, mouth, eyelids, and hands were ripped off by her employer's 200-pound pet chimpanzee. The vicious mauling left Charlie Nash permanently blind. You're strong-minded, and you got a great sense of humor. Am I right on all of those?
Yeah, and I'm ready. I want to ride horses again.
The face transplant began with procurement of the donor facial tissue, including the midface, mandible, associated teeth, and the overlying soft tissues. The incision extended from the lateral face inferiorly and was carried out anteriorly below the eyelids, above the nose, and around the neck to the contralateral face. The zygomatic, buccal, and mandibular branches of the facial nerve were identified and divided. Adequate exposure was performed to allow completion of the skeletal osteotomies. Custom-designed 3D printed skeletal cutting guides were fixated into position based on the preoperative surgical plan. Following completion of the zygomatic, nasal frontal, and bilateral mandibular osteotomies, the neck vessels, including the internal jugular veins, external jugular veins, anterior jugular veins, internal carotid arteries, and external carotid arteries, were identified and circumferentially dissected. Final liberation of the donor facial allograft was performed following ligation and division of the major vascular pedicles perfusing the allograft. Concurrently, the recipient's surgical procedure progressed to create a defect for precise adaptation of the donor facial allograft. Comparable incisions were performed in the recipient. This allowed the removal of all external scar tissue throughout the face and neck. All pre-existing hardware was removed prior to face transplantation, and the orbital floors were reconstructed bilaterally using prefabricated titanium mesh. Recipient craniofacial scanning and registration were performed using intraoperative surgical navigation to allow accurate facial allograft inset. Similar to the donor procedure, prefabricated 3D printed cutting guides were fixed into position based on the preoperative surgical plan. This allowed completion of the right zygomatic, nasal frontal, left zygomatic, and bilateral mandibular osteotomies. The resultant recipient facial defect was complementary to the procured donor facial allograft. This allowed precise inset of the donor skeletal segments and overlying soft tissues, as well as coaptations of facial nerve branches and vascular anastomoses. Accurate midface skeletal alignment was ensured. In addition to optimal mandibular contour, rigid fixation of the midface was performed using titanium plates, and bicortical lag screws were used for mandibular fixation. The remainder of the facial allograft was then tailored to resurface the entire recipient defect and achieve final soft tissue inset.